I will be showing you how to do a Skinfold assessment. We will go over 7 different sites and the procedures on taking these measurements. You will need to ask your client to remove sweater and sweats if he or she is wearing any, just like my client is. If your client is a female, she might feel a little uncomfortable taking off her shirt, which is fine. She can leave on a shirt and would just need to pick up according to whichever Skinfold we are doing. For guys, it is a little bit easier to just remove their shirt and do all Skinfold measurements. Also, both male and female need to be wearing shorts. The only equipment you need are calipers. Make sure to check your calipers are calibrated. The needle has to be aligned with the zero. Make sure you are using the same calipers for all different sites. Subject should be standing upright and all measurements should be made on the right side of the body. Pin should be maintained while you place the caliper directly on the skin surface 1 centimeter away from the thumb and finger, perpendicular to the skin fold and halfway between the crest and the base of the fold. Wait 1 to 2 seconds, not longer, before reading the caliper. We will start with the chest measurement. The chest measurement is 1/3 of the distance between the anterior axillary line and the nipple. This will be a diagonal skin fold. So what you will do is pinch the skin using your left hand with your index and thumb. Then using the right hand, locate your calipers about 1 centimeter away from your fingers. Then release the caliper for 2 seconds and take the measurement by not releasing the pinch of your fingers. For males, the measurement will be taken 1/2 the distance between the anterior axillary line and the nipple. Next is the abdominal measurement. This will be a vertical fold 2 centimeters to the right side of the umbilicus. Tricep measurement will be a vertical fold, taking on the posterior midline of the upper arm. You have to measure halfway between the acromion and the olecranon processes. These measurements can be made more precisely by using a measuring tape and marking the exact half point of the client. But in this video, I am just estimating the half point. So I will pull the fat away from the muscle and locate my calipers. Take the measurement and release. Our next measurement is the subscapular. You will try to locate your client's scapula, which can be difficult to locate on some people. Therefore, what you can do is ask your client to put their arm behind their back and you will see their shoulder blade will pop out. Then you can measure 1 to 2 centimeters below the inferior angle of the scapula. This will be a diagonal fold at about a 45-degree angle. The next measurement is the mid-axillary. This skin fold is right below the armpit at the level of the xiphoid process of the sternum, which lies right under the sports bra. Just ask your client if it's okay to move up the sports bra, and this will be a vertical fold. Next, it's the suprailiac measurement. This measurement may be difficult to find, so in order to locate this, it's easier if you ask your client to locate their hip bone for you. This will be a diagonal fold in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. The last measurement we have is the thigh. So have your client rest most of their body weight on the left leg so that the right leg is slightly supported on the ground. The skin fold is located on the anterior midline of the thigh, midway between the inguinal crease and the proximal border of the patella. Again, these can be more precise by using a measuring tape and marking the exact midpoint. This will be a vertical fold. Take duplicate measurements at each side and retest if duplicate measurements are not within 1 to 2 millimeters. Rotate through measurement sites or allow time for skin to regain normal texture and thickness. General skin fold equation you will use to find the body density is the 7-site formula. Men and women use a different formula. All you need to do is plug in the sum of the 7 skin folds and age. Conversion of body density to body composition. According to the ACSM book, percent body fat can be estimated once body density has been determined. These are the 2 most common prediction equations used to estimate percent body fat from body density, and are derived from the two-component model of body composition. These are the charts from the ACSM book, Fitness Categories for Body Composition for Women by Age. Once you have converted body density to body composition, you can plug in your answer and check under what category you fall under. This chart is for women, and this chart is for men.